people still, of course, have so many questions about COVID-19. So joining us this morning is Dr. Henry Anyimadu, who is an infectious diseases consultant at the Hospital of Central Connecticut, to help answer some of those questions that you all have been asking us on Facebook. Good morning, doctor. Thank you so much for joining us here on your Sunday morning. Okay, we are trying to get a hold of Dr. Anyimadu. We're hoping to get him to answer some of those questions here in a second. Some of those questions. Doctor, can you hear me?
Yes, Caitlin, I can hear you.
Good morning. Thank you so much for taking some time to help answer some of these questions. We've been hearing from viewers for days and weeks now about what is going on in relation to this outbreak and epidemic. Can you tell us, can a person become reinfected, or will we develop antibodies to the virus? In other words, can we get this more than once?
Caitlin, that's a very interesting question, but unfortunately we do not have a lot of data to support that. We do know that in general, for viral illnesses, if someone gets any viral illness, they usually will develop antibodies, and those antibodies sometimes can last a lifetime, like measles. But unfortunately for COVID-19, we don't know if those antibodies can last a lifetime or if they will last for a short period of time. If they do last for a lifetime, then yes, you cannot get the infection again. But if they last for a short period of time, let's say 6 months to 1 year, then there's a likelihood that you can have the infection again. But all the data that we are gathering right now suggests that people may be immune for a very long time.
Okay, and
Understand it.
Of course, this is a developing situation. We're still trying to learn so much about the virus. And this is causing so much stress for so many of us, not just here in the United States, but all across the globe. Do you have any practices for the best way to deal with those high stress situations?
I think these are very difficult times, and they are unprecedented times. And one of the things that we keep emphasizing is that physical distancing. And we believe that if we can all maintain that social distancing or that physical distancing, then we can prevent our healthcare systems from getting overwhelmed. In general, apart from physical distancing, we also expect people to be washing their hands, to make sure that they are cleaning surfaces that are frequently touched, to make sure that they are covering their cough and covering their sneezes. If we do these things, then we can truly try to curb the trajectory of this illness.
Okay, fantastic. And one of the questions that so many people have been asking is, where are we exactly on the curve of this outbreak? Do we know, will this get worse before it gets better? Are we expected to peak anytime soon?
It's definitely going to get worse before it gets better. With most of these epidemics that we know from history, it's definitely going to get worse. I can't say for sure whether we are peaking, but I don't think we are there yet, and we are going to peak. It's definitely going to get worse before it gets better.
Okay, that's some good information for our viewers. Expect it to get worse before it gets better. No exact timeline there. So I want to go back to the emergency rooms. A lot of these medical health care facilities are seeing increase in volume. They're also dealing with some issues getting equipment. What are doctors seeing in those emergency rooms, and who should and should not go to the ER?
I think everyone who is sick should call their primary care physicians first, or call the Hartford Healthcare Command Center. We have a clinical care center that you can call. The number is 860-972-8100. And these are clinicians, these are nurses that are waiting to take your call, and they will guide you through exactly what you need to do. Because we're seeing that if a lot of people go to our emergency rooms, not only do they risk infecting our healthcare providers, but they risk getting the infection as well if they don't already have it. So it's very important that we go through these clinical command centers. And there are several other ways to get information. There's a text number that you can text. You can text COVID-19 to 31996, and you will get all the information that you need. And someone will be at the end of the line to guide you through exactly what you need to do.